Hey guys, it's Matthew Zachary, and I want to tell you about the National Comprehensive Cancer Network, or the NCCN. The NCCN creates the treatment guidelines for doctors that help cancer patients lead better lives. But I want you to know that the NCCN also has guidelines for you. The patient guidelines were funded by the NCCN Foundation and were created just for people with cancer and their caregivers. They're free, they're easy to understand, and they're available right now for you, the patient and the caregiver. So go check them out at nccn.org/empower. That's nccn.org/empower.
Hello, Heart of Healthcare listeners. I'm your host, Hallie Tecco, and today we are going to be talking about food as medicine. Many people believe America's health problem started as a food problem. Today, more than 1 in 10 Americans do not have reliable access to nutritious food. More than 100 million people in the U.S. suffer from diet-related diseases. Studies have shown that good nutrition can promote positive health outcomes, and medically prescribed diets have proven to work in reducing common conditions like hypertension and diabetes. Yet food as medicine programs have struggled to scale, and often it's easier for doctors to prescribe medication than it is to prescribe food. So can technology help? Today's guest, Fidji Simo, took the helm of Instacart in 2021. After recognizing Instacart's role as a staple in millions of households and at the intersection of food and health, she helped launch Instacart Health, focused on nutrition security, making healthy choices easier, and scaling food as medicine programs to help people live healthier lives. Fidji, welcome to the show.
Thank you so much for having me, Hallie.
I think a lot of people see grocery delivery as a luxury. Can you tell us how grocery technology and delivery can actually promote nutrition security and health equity?
Absolutely. And I think that's really at the heart of what we're trying to enable with Instacart, where we're trying to make the service as accessible and as affordable for all Americans. And right now, we reach 95% of the US with fresh food delivered in under 2 hours. And so in terms of, providing access to that nutritious food, we've already really covered all of the US, including 93% of food deserts. And so we really obsess over having the service as accessible as possible. In terms of affordability, that's kind of the next step. And we have put in place a lot of different ways for people to be able to afford grocery delivery. A good example of that is that we were a pioneer in bringing the SNAP program online, the food assistance program in the US. And that has resulted in millions of people being able to purchase their groceries online using SNAP benefits. And that's really important because, when you look at these lower income communities, very often they're trying to pack 2 jobs in one day. They don't have access to a car. And so the idea of being able to skip the trip to the grocery store and getting groceries delivered is incredibly important and almost even more of a value add for these populations and for the higher income populations that we typically associate grocery delivery with. And so this is just one example of what we're doing to make the service more affordable. But going forward, we think that it will require even more actors coming to the table, like payers, like providers, to also be part of the solution of making grocery delivery more accessible.
So for listeners who aren't familiar with SNAP, it is the largest federal nutrition assistance program for low-income individuals in the U.S. Something that's top of mind right now for a lot of folks is that there's an upcoming expiration of emergency SNAP funds. Can you tell us about what's happening?
Yeah, absolutely. So on March 1st, 32 states are ending some of what's called the emergency funding for SNAP. And so that means that for SNAP recipients, their budget for grocery is going to be reduced by about $95 a month. And so as a result of that, food banks are anticipating a big rise in volume in March from families needing more assistance as a result of these changes. And that's made even harder by the fact that food banks are already struggling with rising food prices, and therefore the ability for food banks to acquire food and stock up their shelves in a manageable cost. And so as part of that, we are launching a program called Community Carts, which we did during the holidays, but we're expanding now because of what's happening with SNAP benefits, where any person that comes to Instacart can contribute specific food items to a network of food banks from Feeding America. And the food banks are determining a set of items that they most need to stock up on their shelves. And individuals visiting Instacart can just pick the items that they want to donate among that list. And our personal shoppers go and deliver these items to food banks directly. Another thing that we're doing as part of this very big change is that we are expanding our discounted Instacart Plus membership for people on SNAP benefits. And this is something that allows you to get free delivery on your orders. And we are allowing SNAP beneficiaries to purchase this membership for 50% off for the next year compared to other users.
So what you guys have implemented is a sliding scale offering. So for those of us who can't afford to pay the $9.99 a month for a membership or $99 a year for a membership, we can. And then those who that would be too much have a lower price.
Yeah, like for regular people, it's $99 a month, $99 a year, sorry. And then for SNAP beneficiaries, we're making it $5 a month, $4.99 a month for the next 12 months. So to your point, this is really a sliding scale. I love the way you framed it, because a good example of that is, if we launched recently the ability for people who really value convenience over price to pay an extra $2 for a faster delivery. Meanwhile, if you value price over convenience, we actually credit you back $2 if you are okay with receiving a delivery the next day or during a 3-hour slot. And so that allows us to really serve all of the US, which is interesting because if you look at the demographics of Instacart 3 years ago, it was primarily for affluent audiences. And now if you look at our demographics right now, it actually mirrors the split of US population pretty closely. And that's a result of all of the programs we've put in place to make the service more affordable.
So tell us about launching Instacart Health. And you guys collaborated with the White House on the conference and have been, leading the way in terms of accepting EBT and SNAP. Tell us, Instacart Health. I mean, you're building a healthcare company now.
I think we see ourselves much more as a technology partner to the healthcare industry. But fundamentally, when I joined Instacart, it was so obvious to me that we are at the heart of the relationship that people have with food. And, food is medicine. So fundamentally, we're at the heart of the relationships that people have with their health. And I really believe that health starts in the kitchen. And so the launch of Instacart Health in September was actually something that I felt very strongly about even before taking the job. And so it's been really interesting to see just in the last 6 months, the traction that we've had with payers, providers, employers, nonprofits, really wanting to leverage Instacart to scale all of their food as medicine programs, because food as medicine has been, something that's been talked about since the 60s. At this point, there are very few people arguing that health starts with, a healthy diet. But when you look at what the healthcare industry has been able to do to actually embrace preventative care and really scale these programs, it's been, really disappointing, to be honest. honest. And a big part of it is because, if they wanted to scale these programs, they would have had to partner with a lot of retailers because, people want the dignity of choice. And so that's very hard to scale for a, given hospital system or even a given payer. We provide that. We have already, on our platform, we already have 1,000 plus retail banners. We deliver from 80,000 stores. So we already come to these payers and providers with this amazing infrastructure that really allows them to scale these programs without having to do it in a really subscale way. Like, we've seen some providers sending one-off produce boxes to patients. And, that's great as a first step, but that's not the kind of thing that's going to provide a long-term sustainable change in behavior and is going to scale to, many millions of patients. So what we provide is a really scaled solution for both payers and providers to do so.
So I had Michael Moss, author of Salt, Sugar, Fat, and Hooked on the podcast, and he is an investigative journalist who talked about how big food companies have literally got us hooked on junk food and how this has disproportionately impacted low-income individuals. How can technology help people make better food choices?
Yeah, so that's really interesting, actually, because we did a study with No Kid Hungry, which showed that on average, online shoppers spend more than $5 more on fruit and vegetables compared to in-store shoppers, without even increasing their total grocery bill. And by the way, that also applies to people who are on SNAP benefits. So even lower, like that holds true even for lower income populations. And when I started digging into why on earth would that be the case, a lot of times it comes down to the fact that people can better manage their budget online. And so they know that they're not going to exceed a particular weekly budget that they have for grocery. And they are able, as a result, to fit in fruit and vegetables as part of that diet and maybe take out a couple of other things that were less healthy. And so that's been really enlightening to see that by just, giving this simple tool of budget management, you can actually end up with better health choices. We also are investing a lot in inspiration and education. So, for example, we have made a lot of partnerships with publishers, like a good example is Hearst, to bring health-focused recipes on the platform that you can then purchase the ingredients to make the recipe in just one tap on Instacart. So that has also been, really helpful. We have created a product called Shoppable Carts, where health experts and influencers can create these curated carts. Imagine, low sodium lifestyle, or what to eat if you have diabetes, where you can literally purchase again in one tap. And then we have also added health labels, so like gluten-free, dairy-free, across 500,000 items in our catalog, so that people can sift through products more easily to find what they need. And our core principle across all of that is that we don't want to be in the business of telling people what to eat. That's something fundamentally personal. And we don't think that telling people this is good and this is bad really helps. But we think that we can inspire them and nudge them towards, healthier outcomes, especially if we bring, experts and influencers that they trust on the platform and inspire them to make these choices.
Yes, I love that. And the recipe section, which is very prominent in the app, almost reminds me of Pinterest. You see these really beautiful food photos. Some of them are videos, and you can kind of get inspired for what to eat. Are you guys making it a priority that you're showcasing healthier recipes in that recipe section?
Yes, we are. Yeah. We are definitely prioritizing that. We're also prioritizing pop-ups on our homepage. So these are basically mini stores that are curated, and a lot of them have a health bent. So think like, your vegan favorites or low sodium lifestyle again. So that's a way for us to expose people to items that they may not have thought about. They may not, they may not be part of their usual diet, but help them change their diet in a really easy way.
Yeah, I love that. So you were born from a family of, correct me if I'm wrong, 3 generations of fishermen in France. Yes. Tell us about this amazing journey from a fishing village to Silicon Valley.
Well, I was the first one in my family to even graduate from high school. So not totally destined to end up here. But clearly I had food, in my DNA from the get-go. And it's been interesting being in a family of fishermen, because I find that the people who feed the world take so much pride in their work. And it's such an ancestral and meaningful job. And so when it was time for me to kind of decide whether I was going to take the Instacart CEO job, I kind of was able to find a lot of parallels between the grocery industry and even, grocery partners, many of whom have family businesses, and my own upbringing of, finding so much pride in, feeding the local community. So that's been amazing. And then, on the journey, I was always fascinated by technology, having been exposed to none of it growing up, and also fascinated by the US, mostly because I was watching way too much American TV.
And What shows were you watching?
Well, I always joke that I picked California because I watched the OC quite a lot, and in my first flight to California, France to California, I literally had the soundtrack of the OC, California, here we come. And so, I love that. You can do more cliche than that. Yeah. But my American dream became true, and so I've been on this journey of really trying to figure out how technology can impact people's life, but in a really pragmatic way. I always say that I'm a pragmatic technologist, because I've seen, even in the fishing industry, how technology can have very concrete, practical applications. And so I love technology, but the thing I love the most is how can it be applied to solve real important human and societal problems. And, I think nutrition is definitely one of them.
Yeah, absolutely. And how old were you when you came to California, and what was kind of your first foray into technology?
Yeah, I think it was 2008, and I did an internship at eBay in France, and then begged them to hired me in California, and so that was kind of my first technology experience. And again, it was not technology for the sake of it. eBay was really about connecting people around commerce, and technology making that possible. And so that was, fascinating experience. And then a couple of years later, I moved to Facebook, and I spent 10 years there, really also focused on this idea of connecting people.
We'll be right back after the break.
The COVID-19 pandemic showed us how a microscopic virus could upend our lives, and how unprepared our society was for it. There's so much more out there that we need to understand, which is why I recommend subscribing to Crooked Media's America Dissected, hosted by former Detroit Health Commissioner Dr. Abdul El Sayed. Each week, Dr. El Sayed sits down with doctors, scientists, culture makers, and policy leaders to ask questions like, how could new genetic discoveries change our relationship with our own genes? How could addiction to social media change our brains? or how even climate change could make the next major pandemic more likely. To hear discussions on these topics and more, check out America Dissected from Crooked Media. New episodes drop every Tuesday. Listen on Apple Podcasts, Spotify, or wherever you get your podcasts.
I ask this question to a lot of my healthcare guests, which is that, we all face naysayers in healthcare. There's a lot of negativity, a lot of folks who don't believe that things are going to change. I like to consider myself an optimist, and you really have to be an optimist to be a founder. Can you tell me about some of the biggest roadblocks that you've faced in your work with Instacart Health?
Yes. I think, the biggest thing is that people fundamentally can see sometimes how the landscape can completely change. They're very focused on the boundaries they've been trained to have. And, nutrition is a good example. Like, there's so many healthcare, organizations that really don't consider that part of their scope. They don't consider that, they don't consider food to be part of healthcare. And that's a real challenge because, I think a big part of the problems that we face in the US is that healthcare has really become sick care and not treating people to stay healthy, but really only treating them when they're sick. And so a lot of what we've had to do is actually educate about the fact that things can change, in fact, and that if you take a broader view, there's actually a real business case for nutrition. There's a study that came out recently that shows that if all payers were reimbursing the cost of healthy food for all diet-related conditions, they would save $185 billion in healthcare costs over 10 years. That's a massive number. And so, when you take a step back and you think about this industry and the incentives that drive it, I think people don't always realize that it is not just like what we're talking about here is not just doing these things because they are the right thing to do. It's also because there's a massive, business benefit that I wish more healthcare leaders were seeing. But to your point on optimism, in the last, I would say, few months, very much catalyzed by the White House conference, I have seen a change. I have seen a lot of healthcare leaders actually embrace some of these ideas and realize that change is possible. And we're seeing it in particular in the Medicare and Medicaid space, which has to be innovative, obviously, given their setup. And they have to think about preventative care. And so we're starting to see a shift in that direction. And my hope is that more healthcare organizations join in.
Yeah. One of the issues is that the health plans, if it takes 10 years to kind of see that ROI, someone else might be benefiting from it. So they're not going to make that investment. But when you look at Medicare, Medicaid, someone might be on that path for a lot longer. So they could recoup the investment. How do you think we fix that?
You're absolutely right. And we hear that pushback so many times on the fact that, no one wants to be the first mover just in case, these people move. I think, it is really about payers realizing that if they actually all move together in this direction at the same time, it will actually result in massive business benefits for them. And I think, they're starting to realize that. They're also starting to realize that employers are looking for these benefits. And, obviously employers have a lot of sway with payers, and more employers are thinking about, how to keep their workforce healthy, happy, well-fed, and demanding more work in that direction, which I think is going to be a good pressure point for the ecosystem.
Yeah. Yeah, I hope so, because I agree that this is something where if we could get the health plans, the providers on board, then it makes, the technology can fuel making this happen, but having those who are actually running the system buy in is critical.
It is very clear that if someone is food insecure, feeding them is going to result in better health outcome. And honestly, no one is pushing back on that anymore. But when you look at food as a way to help improve chronic conditions, whether it's diabetes, etc., there's a general acknowledgement that, of course, it's going to have a positive impact, but there's not a lot of precision. Meaning, like, if you go to a doctor right now and you have, particular health conditions, the doctor is going to be able to prescribe a particular pill at a specific dosage at a, specific time of day. We don't have that for food. We don't know if we should be giving you X amount of vegetables for that condition. How long is this benefit? Does this benefit need to be funded for to create real behavioral change over the long run? And all of these questions are still a little bit unanswered. And so we're seeing a lot of, providers and payers embrace that and not wait for all of that data to come in and run a lot of pilots and tests, which is encouraging. But fundamentally, over the long run, we need to solve these questions and have real food formularies so that we know exactly what to fund at which moment in time to best benefit health outcomes.
Yeah. So I'm not sure if you've seen these photos of school lunches around the world, but I'm pretty sure the lunches that I had in public school in Ohio looked different from what you were having in coastal France. What are your thoughts about how we feed our children and what we can do better?
I mean, the thing that's really crazy to me is that childhood is such a critical moment, both for, long-term health outcomes, but also long-term healthy behaviors. Like this is a moment during which we're training children on healthy habits and how they're going to feed their families over the long run. And at Instacart, because we're so embedded with, family life, we think about multi-generational health. And if you miss this moment of, teaching kids about healthy food habits, that's a pretty pivotal time that you've missed. And so obviously, I'm even more biased coming from a French background where we were incredibly spoiled with good food growing up. But yeah, I do think that, what we feed our children is critical, and schools have a massive role to play there. And I mean, we've seen the role that they have, especially with food insecure families, in making sure that children are well fed, and having healthy food as part of that is critical. And this is not the only place where this kind of interesting situations happen. If you look at hospitals, like the food in hospitals also tends to be pretty terrible. Like, in fact, when you look at the studies, like staying at a hospital increases malnutrition rate. And that's pretty crazy when, we obviously believe that food is medicine. Hospitals should be also the place where we teach you about how to eat healthier and how to have, better food habits. And instead, we're making you even worse, in these settings. So I think there's a lot that can be done through schools, through hospitals to, use these moments to teach better habits.
Yeah. As I said, I grew up in Ohio and in Cleveland, where we have the Cleveland Clinic, a world-class hospital, but it had a McDonald's in the lobby until pretty recently. They finally, I think, realized it was sending the wrong message. But yeah, I think we need to have these conversations everywhere about how we're feeding our communities. Let's switch gears and talk about one of my favorite things, women's health. You, on top of being CEO of Instacart, recently helped found and launch a women's health company. Can you tell us more about this?
Absolutely. So about 3 years ago, I was diagnosed with a neuroimmune condition, which is basically a condition at the intersection of the nervous system and the immune system. And I realized that the level of care for these conditions, which primarily impact women, was really terrible. And the scientific research around this condition was chronically underfunded. And so I found two amazing co-founders, Dr. Laura Pace and Dr. James Hemp, and we decided to create Metrodora, which is a large-scale medical and research center based in Salt Lake City, dedicated to these conditions. And the real innovation there is that we're really bridging clinical care and scientific research all in one building, with clinicians across specialties, collaborating with researchers and scientists on, developing the path to cures, while also providing patients with the absolute best level of care for these conditions. And as many people know, when you have some of these conditions that affect multiple body systems, you're basically bouncing around usually from specialist to specialist, a neurologist, a GI doctor, a rheumatologist. No one knows what's going on with you. No one has the full picture. And so we really ask ourselves these questions of like, what would healthcare and scientific research look like if it was reinvented from the ground up for collaboration? And so the entire building itself, 60,000 square feet of state-of-the-art medical clinic, is entirely designed for collaboration between different specialties of medicine, between clinicians and researchers, and even collaboration with patients.
And why Utah, not California?
Well, we looked at many different places, and the thing that was interesting is that this is a destination medical clinic, think, similar model as Mayo. And we wanted people to be able to come in from, all across the country. They stay with us from between 1 to 3 weeks. And so we wanted a very, very easy, easy to city to get to. And Salt Lake is the second city in the US that has like the most flights flying in.
Oh, wow.
And so that was a big reason. The second reason is that this is actually a big hub for biotech. And so, we're literally down the road from Recursion and other leading biotech companies. And so that has also been, very helpful as we build not just a medical center, but really an ecosystem of biotech companies around it.
Amazing. So what are some of the opportunities that you see for innovation in healthcare, whether it's women's health, food as medicine, or another area that excites you?
And by the way, before I answer your question, I just want to touch on one point because you called it women's health. And, it's been really interesting because when we launched Metrodora, we actually decided to not call it women's health. And I'll tell you why. Like, even though, 80% of our patients are going to be women, the reality is that there's still this belief that when you say something is women's health, people assume it's reproductive health. It's almost as if they assume women have only one organ, their uterus. And it turns out, women have a lot of different organs. And what we're doing is not reproductive health. It's really, like health conditions that impact multiple body systems. But it's been so interesting to me to realize a bias that people have in really associating women's health with reproductive health, when in fact there's such an untapped market and an untapped potential of really thinking about healthcare in a different way for women, because their immune system behaves differently. They have like so many other differences than just their reproductive organs. So I just thought that was important.
Yeah, it's funny. I just posted something on that topic about how we have to move beyond just thinking about women's health as our body parts and more about unwinding the entire patriarchal system, healthcare system that has been built by and for men. And so actually a lot of the issues that we face are more challenges, systemic challenges that have nothing to do with our reproductive systems, but the fact that test dummies look like men. And so they're the size of men. And so women are more likely to get injured in car accidents and whatnot. But I do agree with that. And I think why I'm drawn to use the word women's health for your company is because I love to see more spaces that are created by women for women in a way that is not, what do I say, like, shrink it and pink it. Like anytime we have something in this space, we want to make it for women. We just make it smaller and color it pink, versus actually think through the entire experience, the whole body experience that a woman has.
Yeah, I so agree. And in fact, it goes back to the last question you were asking me on, like, what do I see as a big opportunities? In my mind, if you look at scientific research, we've kind of reached a diminishing returns, I would say, with the way we're doing it by focusing on each of these organs, like it's scientific research on the heart, scientific research on the brain. I think the next stage of scientific research and discovery is going to be really at the intersection of the nervous system and the immune system, the nervous system and the GI tract, the nervous system and the endocrine system. And a lot of scientific research right now is not done this way. And I actually think that a lot of the conditions that primarily impact women, autoimmune conditions, neuroimmune conditions, are really these conditions that are about the interactions between all of these body systems that we do not understand. And so I think that by focusing on that, even though right now these are women, the conditions that primarily impact women, we're actually going to be making scientific discoveries that impact men as well, because there's very limited understanding of the interactions between all of these systems.
Yeah. How are you educating yourself and getting up to speed on medicine, given your background is in technology, but now you've launched a company in a medical clinic and research facility? What are you doing to kind of get up to speed and get your MD in this?
Well, I'm far from an MD, but I'm incredibly curious. And on top of that, when you have one of these conditions yourself, and, these conditions have a hereditary component. So I really want to avoid, my daughter getting one of them. It creates even more motivation to learn. And so when I got started on, building Metrodora, I actually enlisted the help of Stanford students, and I took classes during my weekends in biology and biotech. And
Cool.
let me tell you, you do not want me, treating patients or designing drugs quite yet. But I learned enough.
Soon, though.
I learned enough to be able to be helpful, and a big part of the role I've played is really connecting the clinic and my co-founders with this incredible constellation of new technologies, biotech technologies that take, 17 years to make it into clinical practice, which is insane when there's so many advances right now that could be helping patients, but because, as we know, healthcare is quite slow, really don't make it to clinical practice in any amount of time that helps patients. And that's fundamentally one of the things that we want to change.
Yeah, absolutely. I always say we need more diverse perspectives in healthcare. And I think the systems thinking that you've learned in technology kind of brings a fresh perspective on solving age-old problems.
Absolutely. And even if you look at our founding team, one of my co-founders is a MD PhD. The other co-founder is a top scientist PhD. And, I'm a technologist. And so even our founding team is actually a representation of our mission of breaking down the silos between clinical practice, scientific research, and technology. And if you break down all of these silos and, to your point, bring in a very different perspective of how to solve this problem, you get better results. And, in technology, when we have a hard problem, what do? We just bring the best people from each of our teams across product, engineering, design around the table, and we start brainstorming. And, very naively, when I got sick, I thought that was what was going on in healthcare. I was like, hey, to my doctor at the time, I was like, are you brainstorming with scientists on this hypothesis? And he was like, oh, no, we don't talk usually. And so, for me, it was like, oh my God, this is a problem that is so critical. It touches people's health, and they're not applying the techniques that are pretty much, proven for how to get the best ideas and how to innovate. And so that's why we decided to build Metrodora in a very different way, very anchored on collaboration.
I love it. And hopefully more folks can learn that lesson and we can be more collaborative. I think we need more of that within healthcare. Our problems are too big to solve them in a silo. And we need as much help as we can get. So Fidji, we so appreciate your time today and wish you all the best on both of your ventures. And thank you so much.
Thank you so much for having me.
Thanks for listening to this episode of The Heart of Healthcare. If you like the show, be sure to subscribe, leave a review on Apple Podcasts, follow us on social, and tell all your friends to listen. The Heart of Healthcare is a product of Offscript Health. We are a healthcare engagement company built for patients and caregivers by patients and caregivers. Our executive producers are Matthew Zachary and Andrew McDowell. Our host is Hallie Tecco. For advertising and media inquiries, email media@offscript.com. That's media@offscript.com. For more information, visit offscript.com.